my name is Haley and I'm going to be demonstrating an NG insertion and removal. So the first thing I'm going to do is check the patient's chart for the order to insert. I will then identify my patient, introduce myself, explain the procedure, that it is an uncomfortable procedure. I'll also make sure that the curtain's closed and the door is shut. And perform hand hygiene. So first I will assess my patient, ask them if they would like any anesthetic before the procedure, just to numb their throat and their nares. And then next I'm going to gather my supplies. I'm going to make sure that my patient has an emesis basin, tissue available, and that they are in an upright position and that the bed is raised to a comfortable position. And then I'm also going to apply a chuck to my patient. Okay. And then, like I said, I'm going to have my supplies ready and I'm going to apply gloves. So next I'm going to have my patient check which nostril they are able to breathe out of better. So my patient made me aware that they can breathe better out of their right nostril. So next I'm going to take the tubing. I'm going to measure from the nose to the tip of the ear down to the xiphoid process. And I'm going to take a marker and make a mark on the tubing, or I could take tape and do the same thing. I'm also going to prepare tape for later in the procedure.
Oh, and then you have to measure that.
I'm going to have my assistant help me with the tape. So I will do my marking on my tubing and I'm getting tape prepared. So the next thing I'm going to do is I'm going to lubricate 2 to 4 inches of the tubing. And then I'm going to prepare my patient, just ask them to breathe regularly during the procedure and to let me know if there's any discomfort. I'm going to have them tilt their head back and I'm going to start inserting the tubing. If I were to reach any resistance, I would take a tongue suppressor and flashlight and check the placement of the tubing. And then next, to continue advancing, once I reach the throat, they're going to tilt their head down and sip on water. And every time they swallow, I will advance the tubing. So on this mannequin, it won't advance any further, but you would advance down to the mark that you made. So after that, I am going to hold the tube in place with tape for now, while I check the placement. I am going to take some of the stomach acid out and I'm going to assess the color, the amount, make sure that everything is normal, and then I will also test the pH. I would take a pH strip, make sure that it is in normal range. And then I'm going to return the stomach contents. So once the placement is checked, I will remove the placeholder tape. And I will apply a skin protectant. And then I'm going to place the tubing. Okay. Wrap the tape around. Okay. Across the bridge of the nose. And then at this time, I would take my tape measure and measure from the tip of the nose all the way down for future reference and charting. I'm also going to pin the tubing to my patient's gown. I'm also going to make sure that there's enough room that they can move their head, everything is struggling. And pin it to the gown. Then I would ask my patient if they would like any oral care done right after the procedure. And I'm going to make sure to check regularly on my patient, and also make sure that I check the placement frequently. And then I'm going to perform hand hygiene, make sure that my patient is in a comfortable position, and that's all. Alright, so next I'm going to remove the NG tube. So I'm going to start by unclipping it from my patient's gown. And then I'm going to remove the tape. If I would need any adhesive remover, I would use that at this time. Okay. And then I'm just going to ask my patient to take a breath, and they're going to hold it. And then I'm going to start removing the tube, coil it up in the chuck that I have placed here, and then I would discard. And then I would remove my gloves and perform hand hygiene.